Okay, now benzodiazepines for epilepsy. These bind to GABA inhibitory receptors and reduce the firing. Most are for emergency or acute seizure. Clobazam may be as an adjunct therapy for seizures. Diazepam is available for rectal administration for generalized tonic-clonic seizures. Brivaracetam. This is approved treatment for focal onset seizures in adults, and this is strong CYP inducing medications will trigger its concentration. This is a moderate inhibitor of epoxide hydrolase, and it will result in increased metabolites of carbamazepine. Carbamazepine will block sodium channels and will possibly inhibit the generation of repetitive action potential in the focus. This is for focal seizure, generalized tonic-clonic, trigeminal neuralgia, bipolar disorder. This is an enzyme inducer, and it will increase the clearance of other drugs. Hyponatremia will be noted. Now you can see these are anti-seizure drugs and the enzyme. CYP1A2 is for carbamazepine, CYP2C8 is for carbamazepine, CYP2C9 is for carbamazepine, valproex, phenobarbital, and phenytoin. CYP2C19 is for clobazam, divalproex, felbamate, phenobarbital, phenytoin, zonisamide, and CYP3A4 is for carbamazepine, clobazam, ethoxyzamide, perampanel, tigabenil, and zonisamide. Whereas UDP, glucuronidase transferase, is for divalproex, lamotrigine, and lorazepam. Now, eslicarbazepine acetate is a prodrug, and it will get converted by hydrolysis to its active metabolite carbazepine, and it will act sodium channel blocker. Ethoxyzamide will reduce abnormal electrical activity in the brain, inhibiting T-type calcium channels. Felbamate is a broad spectrum anticonvulsant agent, and it acts on voltage dependent sodium channels, competing with glycine binding site in the NMDA receptor. It is an enzyme inhibitor for CYP2C19, CYP3A4. Gabapentin, analog of GABA. It does not act on GABA receptor, but it enhances actions or convert to GABA. Gabapentin will bind to alpha 2 gamma subunit to voltage gated calcium channels. Gabapentin will not bind to plasma protein. It is well tolerated by elderly and few drug interactions. Lacosamide. It will affect voltage gated sodium channels, dizziness, headache, and fatigue. Adverse effects. Lamotrigine blocks sodium channels and voltage dependent calcium channels. Wide variety of seizures: focal, generalized, absence seizures, Lennox-Gastaut syndrome, bipolar disorder. Now, levetiracetam, it is approved for adjunct therapy for focal onset myoclonic, primary, generalized tonic-clonic seizures in adults and children, and it will cause mood alteration. Now, oxcarbazepine is a prodrug, and it will convert into an active metabolite, and it is used in focal seizure for children. Perampanel is a selective alpha amino 3 hydroxy 5 methyl 4 isoxalopropionic acid antagonist. Just remember that it is used for focal, generalized tonic-clonic seizures. Phenobarbital and primidone. They act on GABA-mediated neurons and used for status epilepticus when the other treatments are not working. Phenytoin and fosphenytoin. Phenytoin blocks voltage gated sodium channels. Phenytoin is a potent enzyme inducer. Now you can see this gingival hyperplasia when the patient is treated with phenytoin. Fosphenytoin is a prodrug, and it is a drug of choice for IV and IM administration of phenytoin. Pregabalin, focal onset seizures, diabetic peripheral neuropathy, prostrophic neuralgia, and fibromyalgia. Rufinamide acts on sodium channels, and it is used for Lennox-Gastaut syndrome in children old and older adult. Tiagabine. Tiagabine is used as an adjunct therapy in focal seizures. Topiramate has multiple. It has voltage gate dependent sodium channels, voltage calcium channels, NMDA, and it inhibits CYP2C19. It is an enzyme inhibitor, and phenytoin carbamazepine. It has drug interaction. Renal stone, glaucoma, oligohydrosis, hyperthermia are some of the adverse effects. Valproic acid and divalproix. Blockade of GABA T, and they are used for focal and primary generalized epilepsies. Vigabatrin. Vigabatrin acts as an irreversible inhibitor of GABA T, and it is associated with visual field loss and participate in REM program. Zonisamide is a sulfonide derivative with a broad spectrum of action. It is used for focal epilepsy and metabolized by the enzyme. Now, the last, status epilepticus. 2 or more seizures occur with a recovery of full consciousness in between episodes. May be focal or generalized, convulsive or non-convulsive, but this is life-threatening and requires benzodiazepine followed by slow acting such as phenytoin, fosphenytoin, dialpress, and levetiracetam. Now, women's health. In cognitive function at 3 years of age after the fetal in utero exposure to valproate when compared with other commonly used is associated with increased risk of impaired cognitive functions for 3 years of age.